Back from his first foreign trip, President Trump's focus will now shift to his domestic agenda, his new budget, and a bill to repeal and replace Obamacare. Joining us to discuss the president's priorities from Springfield, Illinois, the Senate's #2 Democrat, Dick Durbin, and here in Washington, Louisiana Senator and Dr. Bill Cassidy, who's on both the Senate Finance and Health Committees. Well, Senators, before we get to the Trump agenda, I got to ask you about the big story in Washington this weekend, the Jared Kushner story, discussions about setting up a possible back channel with Russia. Senator Durbin, what's wrong with that?
The bottom line, of course, is we now have a special counsel in Bob Mueller. I have the highest level of confidence in him, and I hope that he will follow all the evidence, all the leads, and all the suggestions, and I'm sure he will.
Do you have any specific comment about the Kushner conversation and whether or not he should keep his security clearance?
Well, of course not. I mean, this is a rumor at this point, and whether it is something that should be followed up on, I'll trust Bob Mueller's judgment.
Senator Cassidy, are you troubled by this?
I agree with Dick's assessment, and I'll say when you speak to folks back home, voters across the nation, they're more concerned about their climbing health care premiums and the need to have jobs with better wages and better benefits. This will play out. We will know eventually. Right now, Americans need help with their premiums.
Well, you know what then, gentlemen? Let's switch to health care. And the Congressional Budget Office, nonpartisan, released its score of the House bill this week, and let's put the numbers up on the screen. It would reduce the deficit $119 billion over 10 years, but 23 million more people would be uninsured by 2026. The cost of insurance, according to the CBO, for a 64-year-old earning $27,000 a year would increase from $1,700 a year under Obamacare to more than $13,000 under the GOP bill. Here's what Senate Democratic leader Chuck Schumer said this week.
Unless you're a healthy millionaire, Trump care is a nightmare. This report ought to be the final nail in the coffin of the Republican effort to sabotage our health care system.
Senator Cassidy, is Schumer right?
So the Senate will write its own bill. And it shouldn't be the final coffin, because right now there's families sitting around their kitchen table. They're paying $20,000, $30,000, and $40,000 a year for premiums, and there's about to be a $40% increase in many states in these premiums. Cassidy Collins, a bill I've introduced with Susan Collins, we have 4 co-sponsors.
We're going to get into that in a second.
But that said, actually would meet that family's needs. And I think it should be a place we go, and those families are asking us to address this issue.
So what would you say to Americans? How should they regard the House bill?
As a House product, the Senate will have its own product. We will go to conference, but I think the Senate product, I'm hopeful, will be more likely to address their needs.
Senator Durbin, I know you're going to say, and the CBO certainly indicates there are problems with repeal and replace, but Obamacare has its own problems. You heard Senator Cassidy mention some of them. Blue Cross Blue Shield of Kansas City just announced this week that it has lost $100 million through 2016, and that it is going to pull out of exchanges. That means that in 25 counties in western Missouri, they may have no insurer at all. Doesn't something have to be done dramatically?
Well, it should be. First, we ought to have an administration that supports our health care system. What the Trump administration has done since day one is to find ways to cut off support for our current health care system. Lack of advertising, for example, to bring new people on board so we have larger insurance pools and lower premiums. We have to have an effort made to sustain the current system while we repair it. We shouldn't be sabotaging it. And let's look at the bottom line here. What the Republicans...
Senator Durbin, let me just point out, when Blue Cross Blue Shield of Kansas City says they've lost $100 million through 2016, you can't blame that on Trump. He wasn't president.
No, of course it is not a situation where the system we have is perfect, and it isn't. I voted for it, and it needs to be repaired, and I think Bill Cassidy and Susan Collins are at least willing to sit down in a constructive fashion and deal with that. Bill and I have had conversations about that. I'm sorry that the two of them are not in the room with the 13 apostles that Senator McConnell's chosen to come up with the Republican plan. Well, I wish Bill and Susan were in there.
Let me bring Senator Cassidy back, because let's talk about the Collins, Susan Collins, Republican senator from Maine, and Cassidy plan, and here are some of the highlights of that plan. Keep most Obamacare taxes to pay for a replacement instead of an individual mandate. That would end. Auto-enroll people in insurance so they have to opt out, not opt in, and let states keep most of Obamacare if they want. Senator, it's a very interesting plan, but I don't have to tell you, there are some of your more conservative colleagues in the Senate who are never going to go for this because they're already upset that they say the House plan leaves too much of Obamacare in place. You're leaving more of it in place.
A couple things. It is a conservative solution. A conservative thinks that power should return to individuals and to states. We do that. The power that Obamacare took from states, we give back. And you can't say you're a conservative and we believe in states' rights and then tell states what they cannot do. If a blue state wishes to do a blue thing, God bless them. And as regards to taxes, it isn't so much that we have to keep these taxes. As a fiscal conservative, I do think we need to pay for things. We have to balance our budget. We just say those taxes should be addressed in comprehensive tax reform, not piecemealed beforehand. I will repeat, Cassidy Collins' plan is the conservative solution.
But have you gotten any buy-in, and let me just take a few names, from Ted Cruz, from Rand Paul, from Mike Lee, and what are the chances, honestly, that the Senate won't pass anything, that this health care reform is going to die?
I can't speak for those senators you listed. I will say that aside from Susan and I, there's 4 other Republicans who have supported. Now, what would really be good...
That's 6. You need 44 more.
But of all the plans out there, we're the ones that have the most support. And there are others who are very much interested. But I'll also say to my friend Dick Durbin, if we had Democrats involved, because we do allow a blue state to do a blue thing, that's states' rights, that if we had 25 Democrats and 40 Republicans, it wouldn't be a Republican plan, it wouldn't be a Democratic plan, it would be an American plan.
Okay, let me quickly, because I want to get to the budget briefly, but real quickly, Senator Durbin, any Democratic buy-in?
As long as we take repeal off the table, there are a lot of Democrats who want to bring a chair to the table. I'm one of them. Let's sit down together with Bill Cassidy, Susan Collins. I don't agree with their many aspects of their startup plan, but it's a good faith effort to do 2 things: reduce the cost of health insurance and expand the reach of health insurance. That should be our national goal.
All right. Now there's the Trump budget that was released this week, and let's go through some of the highlights of that. Here are some of the key increases in spending. For the military, increased by 10.1%. Border security by 6.8%. But EPA is cut 31.4%, the State Department by 29.1%, and NIH, the National Institutes of Health, by 18.2%. Here's how Trump Budget Director Mick Mulvaney explained it.
Compassion needs to be on both sides of that equation. Yes, you have to have compassion for folks who are receiving the federal funds, but also you have to have compassion for the folks who are paying it.
Senator Durbin, I know you're going to bash the Trump budget, but don't we have to cut spending at some point? Are we just going to keep piling up the national debt?
Well, that's a very, very important question that you asked, Chris, but the question is where you cut and how you cut. I do not believe you make America great again by cutting medical research to the lowest level in 12 years. I don't think you make America great again by saying to working families it's now more expensive for your kids to borrow money for student loans. You certainly don't make us a great nation by cutting back in infrastructure. All those 3 things are in the Trump budget. So if we're going to have priorities, let's look at the things that are important for building jobs and opportunity in the future.
Senator Cassidy, how dead, I know it's dead, but how dead is the Trump budget?
So typically, in fact, always, the Senate and the House write their own budget. But it does reflect the president's goals. I actually agree with those goals, but would take a different approach. Let's speak of Medicaid, which under their budget is cut. Medicaid is unsustainable, both for states and for the federal government. It has to be reformed. But as a physician who worked with Medicaid patients, I know that benefit has to also be preserved. I've actually worked on legislation that would bend the cost curve, at the same time reform it so that states would not go bankrupt trying to continue their Medicaid program. We have elements of that in the Cassidy Collins plan. We share the goal, we just have a different way to get there.
Just real quickly, though, I know you're concerned about the Gulf Coast and Louisiana. You okay with cutting EPA? You're a doctor. You okay with these kinds of big cuts in NIH?
Again, I think the best way to control future health care spending is to find that cure for Alzheimer's. I agree with the goal. I have a different approach. If we find a cure for Alzheimer's, which postpones or heals, then those folks are not taking $1 trillion out of our economy with their illness. Rather, they are contributing. That capital is used for something else. We can actually get at this in a different way.
Senator Cassidy, Senator Durbin, I want to thank you both. for coming in, and thank you for your time, especially in this holiday weekend.
Thank you.